I remember in college, my dad, they had allowed me to use this Subaru of theirs, and it was this kind of the old boxy Subaru. And I was kind of a creative, not kind of, I am a creative person. And I asked my dad if I could hand paint the car like a hippie car. And it was older. They didn't care. They said, sure, you can do a little bit here and a little bit there. So I did some kind of smaller pieces on the car. And finally, I said to my dad, what limits do I have in regards to painting this car? And he said, your creative limits are your only limits. And this car, I painted it head to toe. I had it for years. It was this painted car. That's what you can have in your private practice. You can have a head to toe painted practice, however you want it to be. And that's what I'm so excited about with Dr. Brian Dixon, who's joining us today. Dr. Brian Dixon is an award-winning psychiatrist, author, and speaker who believes in the power of entrepreneurship and self-empowerment, overcoming poverty to educate patients, colleagues, and society about income and wealth inequality. Dr. Dixon owns Mindful, a direct care psychiatry practice in Fort Worth, Texas. Brian, welcome to the Practice podcast.
Thank you so much for having me, Joe. I'm super, super stoked to be here.
Oh, I'm so stoked to have you here. Also, just knowing you're in Fort Worth, just down the road from Latoya, one of our consultants, and knowing that you're influencing that area of the nation is incredible. So now we know at least two amazing people down there. I'm sure there's way more than two amazing people in Fort Worth. So awesome. Well, in your intro, you mentioned right in there overcoming poverty, and would love to hear just a little bit of your personal story because that informs so much of who we become as professionals and our mindsets and what we have to overcome as professionals to think differently. Tell us a little bit about your story of how you got to this point.
Yeah, so I'm originally from East Texas, so a small town called Lufkin that most people have never ever heard of. And growing up, we didn't realize that we were poor. It was one of those things where I think our parents were, working multiple jobs to make ends meet, and we didn't know any different. I didn't know any different until I went to school and filled out the FAFSA. And had to get my mom's information, and I learned that she was making $25,000 a year, raising a family of five, six, including herself, right? And so, we were on food stamps and government assistance, and again, I didn't know any of this stuff. I just knew that. There were some hard times growing up. And so, I'd never learned anything about entrepreneurship or business. And once I finished all of my training, it made me harken back to that time when I was younger, thinking, "Wait a minute, how was she so resourceful and to make ends meet? And how do I duplicate that so that I can live my best life?"
Mm. So you become a psychiatrist. Do you start a practice right away, or do you do like some? I know a lot of people do like hospital work or residencies and all
Oh
that.
yeah.
How'd you end up in private practice?
Oh, Joe, I learned the hard way that I can't work for anybody. So, yeah,
Oh,
so
me too.
exactly. So, I finished training in 2011 at the University of Kentucky. I did a combined program, pediatrics, child psychiatry, and adult psychiatry, and I finished, and I had only been taught how to work in systems. And so, when I got my first job out of residency, I worked at a community mental health, a federally qualified mental health center in Texas. And I thought I was the bomb. I thought I was the shiznit. And so I'm doing my due, and I'm seeing lots of people, and I start to feel that creep of burnout because of the way that the finance system is structured in an FQHC. It's all encounter based. And so, whether you spend 15 minutes or whether you spend an hour and a half, it counted as one encounter. And quickly, my schedule got full and I got burned out. So I said, well, maybe it's just a situation. So I went to a multi specialty group practice and worked there for 2 years and realized, nope, it's not them, it's me. I can't work in a system that doesn't make sense, that doesn't make financial sense, where I don't have any autonomy. And so I quit all of that stuff in 2014 and started a private practice, and just and have grown it since.
Wow. Now, I feel like one thing, and I want to talk about, you have this mental health ecosystem that I want to make sure we get
Mhm.
into. But before we do, how do you think through your business? Because I think, especially psychiatrists, counselors, so much of it's billable time. And so a
Mhm.
lot of times what I see is, just like attorneys or other folks, if you don't show up, you don't get paid. And so in a lot of
Mhm.
ways, you've given yourself a job, not a business. So how do you think through income, how much you work, multiple streams, like, and maybe we'll get into that in regards to the ecosystem, but how does, like, because I feel like psychiatrists, the typical model is, you've got like 15-minute sessions, boom, boom, boom. You're just like pushing pills. You don't have that deep time with
Mhm.
people. And it's just a lot of billable hours. So how do you
Yeah.
think through all that?
Yeah, so my calling is to educate, and most times I can do that education in the form of an appointment. And so during my training, I got used to doing 30-minute follow up visits, working with families and adults, and then my new patient appointments are 60 to 90 minutes because I like to hear people's story, and so that's why I do what I do. And if I could, if I could get paid to do it, why not? And so, yeah, so that's kind of where that impetus came from. I don't like the idea of just pushing pills. Pills, as one of my attendings said, no kid is born with a Ritalin deficiency, right? They're not missing something. You use a medicine to bridge from one place to another, and so and the mystery is in the history. So figuring out where people
Mm.
come from and where they're going is really important. And so I said, I want to be able to hear those stories, but I also have to keep the lights on and provide a some measure of standard of living for myself and my family. And so when I first started, I just pulled a number out of the air as to what to charge. I knew I didn't want to take insurance because insurance literally keeps you from doing what you need to do for your patients. It kind of dictates what you have access to. And I was like, screw that. Excuse my French, screw that shit. I didn't want to do that.
No.
Instead, I said, instead, I want to be able to treat the patient that's in front of me and support the patient that's in front of me. And so that's where it all started. As I then learned business, I was like, oh, I'm undercharging because the horribleness of payroll taxes, I always I misjudged that for years. And trust me, I got more than my fair share of IRS letters like, oh, you owe all this money back. And I was like, what the hell? I don't know what I'm doing. And so I've learned a lot since then. But the key, especially when you're starting to practice, is just pick a number out of the blue. Talk to your friends, talk to other therapists, pick a number, and then go from there.
Now, I love hearing that you're private pay. I think for a lot of people in the medical side of things, sometimes that's a little more common in the counseling world. But
Mhm.
for so many people, it's like, well, I have this benefit. Why wouldn't I use it? So, how did you overcome that in regards to educating your patients on the value of private pay, what they could use in regards to HSAs, flexible spending, out of network benefits? Like, how did you get people to even say yes to that?
Yeah, so I was blessed. I've always been blessed to really believe in myself, and I think that's the very first part. Is you have to believe as a private practitioner that you are bringing value to whoever you're working with, whether you call them a client or a patient. I have a very specific skill set, so I'm really good with kids who throw fits and kids who are acting a fool. That's my jam. And so
Oh, it's so
while I
funny
was
because at mental wellness counseling, I helped angry kids, frustrated parents, and distant couples. So angry
yeah,
kids have been my jam as well. But you just say kids that throw fits. Yes.
yeah, it is a niche, all right, and so
Mhm.
and every therapist and psychiatrist should have one, and so that's what I went on, and so I started my practice focusing on that, which meant there was a whole bunch of people that I did not work with, and as a result, it took me a lot longer to fill my practice, and so there were a couple touch and go times when I was living off my credit cards, but the key is you literally have to go out and network. You have to let people know you exist. At the time, I didn't know anything about Google AdWords and all that kind of stuff. So I was literally just going to different doctors' offices. I was going to Chamber of Commerce events. I was letting people know that I am here and available and taking new patients, and then I made sure to put my fees up front. So I
Mm.
don't like awkward money conversations, and so I made sure from day one. I said, "Here's my fee schedule. Here's how much I cost. Here's what the expectation of if you work with me." And being able to say that, with my full chest was really
Mm.
really helpful in letting people know who I was.
Now, did you get much pushback from, say, primary care doctors in regards to being out of network?
Oh, absolutely. I still get pushback, and I'm 8 years into this thing. I think it's mostly because people have a fundamental misunderstanding of how insurance works. Insurance is a financial product. It is not there for actual health care, and I'm sure we'll get lots of hate mail about all this, but the insurance is very limiting. And so when I explained it to PCPs and other folks, I say, y'all, it's either time or money. So if I take insurance, which I totally can, you're going to get a 5-minute appointment because insurances do not pay psychiatrists to do therapy. And I do lots of behavioral therapy. That is what I'm good at. but they're not going to pay for it. So yeah, so I can give you a 5 minute med check, but everybody goes, but that's not, my patients don't want that. I don't want that. And I go, great. Well, then the money has to come from somewhere. So either I make it up in volume and I see as many people as possible in an hour, or I just charge what I know I'm worth, and you just pay what the worth is, and then I work really hard to keep you out of my office. Like my job is to work myself out of a job, and if I can see you twice a year, then that's the goal, and that way the financial burden is not as high on
Hmm.
my families. And I'm here to tell you, Joe, people will pay for it. I've had people who are on public assistance who save their money to come and see me because they know I work really, really hard for them.
I remember early on when I started consulting, there was a lady who was really good at helping people that had narcolepsy, and she was charging like 120 a session, and she was kind of pushing back on bumping up to 175 a session. She had a wait list, and we walked through, okay, how fast typically do people start having a regular sleep schedule? And it was within like 3 or 4 sessions. And I said, the average therapist, how long does it take? She's like, oh, 12 to 15, if they even help solve this thing. And so we ran the numbers on, okay, so if someone has narcolepsy, they're probably not going to drive themselves to the office. So you have to have someone with you. So you have two people taking time off their work to drive to your office, maybe a half-hour commute, with parking. She was in a big city. And when we ran the numbers of her value, it was like $800 or $900 an hour. And when she saw
Yep.
that, jumping to 175 was like a no-brainer, because she saw her value finally, and just realized, okay, like I am saving people so much time here by doing it. So I love that you think about, hey, if you have to come once or twice a year for like an oil change type session, awesome,
Mm-hmm.
let's do that. Well, walk us through kind of your mental health ecosystem. So I love the title of this. I don't know what it is, and so I want to hear, about how you think through entrepreneurship, how you think through private practice, the mental health ecosystem. Walk us through that.
Yeah, so any ecosystem has multiple components. It's You have a part that feeds another part, and then it's kind of the circle of life. Water and soil and animals and that sort of thing. So that's the biological system. Well, other sectors, other industries have that. So when you look at the financial sectors, financial services industry, they already have an ecosystem. When you look at pharmaceuticals, they have an ecosystem. They know distributors, and they have all these different levels. Well, in mental health care, we have an ecosystem. It's just really broken and siloed, because anytime people say, okay, you have a mental health issue, they think of, Menninger Clinic, or they think of, Mayo, or Massachusetts General, right? And they go, oh, those are big hospitals. Or they will hear about, TMS or ECT, or they'll hear about, Dr. What is his name? Dr. Phil, all those kind of things. Well, at the end of the day, there's a whole level that we're missing, which is the outpatient level. Outpatient meaning being able for somebody to be able to see once a week for a certain number of time, a certain amount of time. And we are getting overlooked because all of the emphasis is on either drugs or big systems, and the outpatient level is the most important level of the mental health ecosystem, and we need to make it more robust. We need to give it more infrastructure. We need to find a way for private practice psychiatrists, therapists, counselors to communicate with each other, to refer to each other better, to then run their practices as fiscally responsible and profitable as possible. Because every single time a private practice goes out of business, it reverberates and it ripples to everybody else in the community. And I want to stop that. I want to make sure that therapists feel supported, that they can pay their taxes on time, that they can live their best life, and then that they can refer between each other really well. And so that's why I've built 3 companies in this space.
Three companies in this space. What companies other than your private practice?
Yeah, so the private practice is the actual execution. So it's the B2C, right? The business to consumer, or in this case, the business to patient. And then we have 2 B2B companies. So Simply Psych is a practice management company. So it teaches folks, and not teaches, it also supports private practices in running whatever they're doing. So, whether you need a full service kind of thing, like you don't have a website, you need to manage your leads, you need to do your marketing, you need to collect money, accounts receivable, all that kind of stuff. We can do that. Or if you just, need that kind of one off, hey, here's that, that business plan. I need to figure out if proper practice is for me. We can do that as well. So that's the B2B kind of practice management side. And then me and a friend of mine, we created a guide, an app called Guide, Gide. And what Guide does, it's a closed database where we can refer and send referrals between therapists. Because one of the funny parts about all of us therapists and mental health clinicians is we love lying on the internet. So whenever you go to a clinician's website, everybody treats everything. And Joe, and I know that that's not the case. There are certain things that we're really good at, but the problem is marketing wise, you cannot go out and market what you're not good at, right? So, for example, I'm really good at kids who throw fits, but for kind of your people who are suffering from depression, I'm probably not the best fit because of lots of different reasons. But I can't go out and market that because if I do that, that would be bad, right? And so as a result, the key is to have a closed system where we can refer to each other a lot easier without showing all of our cards to the rest of the public, and so that's what Guide does.
Wow. So how do you, well, before we move away, are there other parts to the mental health ecosystem before I ask
Yeah,
some other questions? Yeah.
yeah. So I'm mainly focusing on the outpatient part because I'm on a private practice podcast. But the other part is we have to stay in communication with agencies. So I sit on the board of two other kind of community mental health therapy companies. We have to stay in contact with folks who do inpatient. So I'm always talking about how to improve communication for within like hospital systems, both private and public. And then we also have to make sure that we continue to fight stigma. So the ecosystem is it is truly a pyramid. It's all levels of care, all different types of clinicians, regardless of what your licensure is. And so I'm doing those things as well. But I really focus on the private practice because I think that's where we get the most bang for our buck.
Yeah. I'm always interested in entrepreneurs that have multiple kind of things going on. How do you manage your time and your creative energy so that your businesses get kind of your best ideas and it's not just the leftovers or the burnout or that you resent the companies that you own?
The key is you do what you're good at and you don't do what you're not good at. And so, anytime I'm mentoring someone, that's what I coach them on because that's what I truly believe. I am super, super bad at financials, which is why we have a great CPA and we have an account clerk and they do all that stuff because I hate budgets and spreadsheets. And then I'm not the best operations person, and so I hired a really good CEO, and we have a chief communications officer who they can kind of keep all the balls in the air so that I can focus on what I'm good at. I'm a big fan of the business organizational strategy called Traction
Hmm.
and EO, and I'm a member of the Entrepreneurs Organization. And so, yeah, I like Gino Wickman's idea about the seats and getting the right butts in the right seats. And so that's allowed me to scale all of these companies. So, all combined, we have grossed over $1 million last year. And so, I'm just looking to grow those further and help more people.
Hmm. Now, when you think about what gets in the way of people being successful in private practice, what do you notice?
Oh man, a couple different things. Number one, like I said earlier, you have to believe that you are the person to do the thing that you're doing. I know I am called to work with kids. I know I'm called to run this particular company, and because I believe it. And so I'd say that's the first hiccup is people have to get out of their own way. And then the second hiccup, and this is just again talking equity, which is access to capital. So I'm a black guy. The studies have shown that Black people, especially Black women, we just don't have access to capital. And so, to start a business. And so, I've had to basically kind of bootstrap or kind of self fund everything when I started, and that is it's super hard because we also disproportionately have higher rates of interest on all of our debt. So our student loans and our credit cards and our automobiles and our house loans are all higher than our white counterparts. And so, yeah, so the deck can be stacked against clinicians of color, and it's not fair. And I mean, I go out and I try to talk about all that stuff, but those two things, believe in yourself is one, because I want everybody to believe in themselves, but then we also have to live in the stark truth that it is fiscally harder for some of us, and so trying to find avenues to get funding is challenging.
Hmm. When people hear this and they say, "Wow, I have some privilege. I want to use that privilege to help push back on these inequities." What can people with privilege do?
Yeah, so privilege is all in my to distill it down. It's all about money, and so I tell people all the time: make sure you're putting your money where your feelings and your mouth is. Right. So find a black business, buy their T-shirts. Find a black business, buy whatever they're selling. Find a black business, sign up for whatever the service is, whether you need it or not. Like give them cash. I mean, you can also Venmo as long as it's less than $600. Right. I'm kidding, but yeah. In a sense, put your money into the business. It's not about a handout or even a hand up. It's literally just use their business. If they do marketing, if they do coaching, whatever it is, just use them so that then they can increase their revenue. And so that's what I would say. It's not, don't pity them, because every black business owner that I know, they're working their ass off. And so just patronize them with your money.
Mm. So the last question I always ask is, if every private practitioner in the world were listening right now, what would you want them to know?
So, if every private practitioner was listening, I would say it's all about growing the pie. So, when I started my private practice, my business coach said, don't worry about your slice of the pie, just grow the size of the pie. And for the longest time, I didn't really understand what that meant until I did. And now I realize that I don't have competition. There is no competition in the mental health space, because our ecosystem, our infrastructure is so 50 years behind that anytime you do anything, it reverberates, it scales by itself as long as you stick with it and don't think about competition. I could absolutely give a shit if you started a private practice in right next door to me. It does not matter. I don't care if you're a psychiatrist or otherwise. There is no competition. We have a responsibility, especially living in today's age of misinformation and disinformation. We have a responsibility to put out good stuff. And as long as you're, working at an agency and feeling like you're not valued, you're making the situation worse. So speak up, write that ebook, write that blog, do that consulting, do whatever you need to do to get good information out there, because our world literally is hurting for it. And so, yes, there is no competition. Put yourself out there.
Love that so much. If people want to follow your work, if they want to check out your app, your website, any of that, where should we send them?
Yeah, so the two main sites, and I have lots, but the two main sites, so drbriandixon.com, so drbriandixon.com. So that's my personal website where I talk about a whole bunch of stuff. And then my business website is Simply Psych, so www.simplypsych.com. And yeah, and then I'm all over the social medias and all that, even though it's the bane of my existence. It's a necessary evil. So yeah, simplypsych.com and drbriandixon.com.